NCAS Practice Test 2026 Nursing Community Assessment Service Exam Questions and Answers Test Prep. Question 1. What is the primary purpose of the NCAS Computer-Based Assessment, CBA? To assign a pass/fail grade. To identify strengths and gaps in clinical thinking. To test physical strength. To evaluate handwriting. The CBA identifies strengths and gaps in clinical decision-making. It's not a simple pass/fail. Question 2. In the NCAS simulation, which standard is used to assess practice? U.S. Nursing Board, Canadian Regulatory Standards, UK Nursing Council, Global WHO Guidelines. NCAS evaluates candidates based on Canadian entry to practice standards. Question 3. How long is the computer-based assessment, CBA, typically? 1 hour, 3 to 5 hours, 8 hours, 2 days. The CBA usually takes 3 to 5 hours to complete. Question 4. Which type of question in the NCAS CBA requires selecting exactly 3 best actions? Multiple choice, multiple select, fill in the blank, short answer. Multiple select questions prompt for the 3 best actions among 6 options. Question 5. What should a nurse do first when a patient's condition suddenly deteriorates? Document the history, perform a rapid assessment, call the family, clean the room. Immediate assessment is the priority when a patient's status changes. Question 6. The oral assessment in NCAS usually follows which component? CBA, SLA, Simulation Lab Assessment, Application Submission, English Test. The oral assessment follows the SLA stations. Question 7. Which of the following is a key component of therapeutic communication? Giving personal advice, active listening and empathy, changing the subject, telling the patient what to do. Active listening is foundational to therapeutic communication. Question 8. What is the hallmark of knowledge-based practice? Following tradition, using evidence and critical thinking, guessing based on intuition, doing what other nurses do. Knowledge-based practice relies on evidence-informed decision-making. Question 9. In a simulation scenario, a candidate is expected to demonstrate memory of textbooks, application of skills in a clinical context, speed over accuracy, ability to work alone without help. The SLA tests the application of clinical skills and judgment. Question 10. When assessing a community, what is a primary informant? A textbook about the town, a resident with direct knowledge of the community, a government website, a satellite map. Informants are people who provide first-hand insights into the community. Question 11. What is the priority when providing care to a patient with a different cultural background? Assume they are like you. Cultural safety and humility. Ignoring culture to be fair. Applying stereotypes. Cultural safety ensures the patient's identity and values are respected. Question 12. Ethical nursing practice requires beneficence, which means doing no harm, acting in the best interest of the patient, telling the truth, keeping promises. Beneficence is the duty to do good and act for the benefit of others. Question 13. Which step follows data collection in the community assessment process? Evaluation, analysis and diagnosis, intervention, termination. After collecting data, it must be analyzed to identify community needs/diagnoses. Question 14. How many scenarios are typically presented in the NCAS CBA? 1 to 2, 5 to 10, 18 to 20, 50. The CBA usually consists of 18 to 20 unfolding scenarios. Question 15. In NCAS, what does professional responsibility encompass? Accountability for actions, working the most hours, always being right, avoiding difficult patients. Responsibility includes being accountable for one's own practice and decisions. Question 16. What is the correct action if a nurse notices an error in a medication order? Administer it anyway. Clarify with the prescribing provider. Ask a coworker to do it. Change the order manually. Nurses must clarify orders that appear incorrect or unsafe. Question 17. In this law, interprofessional collaboration involves working only with other nurses, working with different healthcare professionals, working without a team, supervising everyone. Collaboration involves the entire healthcare team, doctors, PTS, etc. Question 18. A patient's right to self-determination is known as justice, autonomy, veracity, fidelity. Autonomy is the patient's right to make their own healthcare decisions. Question 19. During a community assessment, windshield survey refers to checking car windows, observing the community from a vehicle, fixing glass, measuring wind speed. A windshield survey is a literal observation of community characteristics from a car. Question 20. What is the primary focus of community as partner model? The nurse is the boss. Collaboration between the nurse and community members. Government control. Individual patient care only. This model emphasizes the partnership between the professional and the community residents.